COVID-19 pandemic may have caused over 4 million excess deaths in India, according to a US-based research group. To put that in context, it's about 10 times the official death toll of over 400,000 in the country. Excess deaths are a measure of how many more people are dying than would be expected compared to the previous few years. I put it to the BBC's Ambara Sanatirajan, who's in Delhi, that 4 million is the current estimated total for deaths from COVID across the entire world.
That's why this study is getting a lot of traction, because so far various studies have suggested twice or three times more than what the official figure of the Indian government says about this death toll. So this is like really a startling figure when they're talking about 4 million people, much higher than what the United States and Brazil are showing as their official figures. Now, how did this happen? Because many of these researchers believe that what happened in the hinterland, the rural areas of India, where many people died in their homes, and the relatives would have simply taken them and cremated them or buried them in the riverbed or lake bed somewhere near to their village, and these people were not taken into account. And even these figures, what the government is saying, came after various state governments. They revised their official tallies, and thanks to the work of the civil society and also journalists who have been meticulously looking after how many people are actually dying by looking into the figures from the crematoriums and hospitals. But still, the revised tally is far, far, far behind what this Center for Global Development is saying. And they're using three methods, basically looking at the birth and death registrations, and also blood tests based on the how prevalence this virus was in India, and based on a consumer survey. This will come as a huge surprise for the government, which has been still maintaining that the official figure is about 414,000 so far.
And what's happening in terms of the vaccination drive in India? Because that is a key weapon in the fight against this, and to stem the rise in any more deaths.
The authors of this study, they point out that knowing how many people actually died in the pandemic will help you to prepare for the next wave. For example, the fight against this virus is one of the best ways is to vaccinate as many people as possible. India launched its what they described as the world's biggest vaccination drive earlier this year. But then it has slowed down because of shortage of vaccines. And now what the government is saying is that nearly 1/4 of the population, they have received the first doses. But again, those who received the two jabs, so it's hovering around only 7%, still the lowest in the world, among the lowest in the world, if you compare it with other countries. The government has been trying to get more vaccines. They are in the process of approving, other vaccines like, Pfizer and Moderna. They have been talking to them and looking at the possibility of, importing more vaccines. But having said that, many critics would point out the government bungled in calculating how much actually they're going to get from the locally produced, for example, AstraZeneca's Covishield, which is produced under license in India, and also Covaxin. But now it is slowly picking up momentum. But many are skeptical whether the government will be able to achieve its target because of the shortage of vaccine.
Ambara Sanatirajan there, speak to me from Delhi.